Senator Whitehouse.
Thank you very much, Chairman, and I join my colleagues in congratulating you and Ranking Member Murray on the success of a year ago. We hope we have more to come. Dr. Collins, one of the things that we got into the Cures Act was a request that you reduce the burden of what we called low-risk subrecipient monitoring. I just left Brown University's Director of Research, who was in the interim a moment ago, and this was also the University of Rhode Island's request. You get things like Brown University and University of Rhode Island working together on a project, and the supposed obligation to monitor their subcontractors now applies to each of them. So you have URI monitoring Brown, Brown monitoring URI. They're both monitored by you and OMB. Can you help reduce the bureaucratic and reporting burden to your subrecipients?
Senator, we don't particularly enjoy doing that kind of low-risk monitoring either, and we have, in fact, thank you to the Cures Bill, put together a proposal of a way that we might reduce the amount of low-risk subrecipient monitoring. There are certain situations that maybe don't quite meet that, but many of them do.
Please,
and those are under review.
To include us in that cycle so that we can be helpful in giving advice and making sure that goes forward at a
be happy to.
Good pace. Dr. Gottlieb, the Cures Act was very good at getting you to FDA to connect the device and the drug sides a little bit better, and you've done a lot of training to try to connect the two. But the original testimony that we had from FDA, from both the drug and the device sides, was that what you really needed was a third pathway for drug-device combinations. Would you assure us that if it turns out that the hybrid effort that the Cures Act established isn't doing the job, that you will let us know so we can take a second crack at it legislatively?
Absolutely, Senator. This has been a challenging area for us over a period of time. We think that the provisions in the Cures Act give us a lot of new tools to address it. We're going to be implementing those provisions and rolling out some guidance pretty soon that we think will articulate a better pathway. But if it doesn't resolve the challenges that you've identified in the past, I'd absolutely be delighted to talk to you about alternatives.
Great, thank you. Just so long as we're staying in touch and in the loop and not wasting time if it turns out not to be productive. Dr. Collins, there have been some very everyday moments that are very significant. Back in 1876, a gentleman called his assistant, Watson, to come into the room. And in 2012, a lady named Kathy Hutchinson took a sip of coffee. Pretty minor things except for the technology involved. Come here, Watson, I need you, was Alexander Graham Bell first using the telephone to summon his assistant. And Ms. Hutchinson picked up the cup of coffee and brought it to her lips through what at Brown University they call the brain gate, which is electrodes in the brain so that by mere thought she could control the robotic arm. The brain technology that NIH is funding is terrific. Are you satisfied that you're adequately connected with DARPA, which is the BrainGate funding, to make sure that everybody's pulling in the same direction?
We are enormously excited about that as well. And yes, we have worked quite closely with DARPA in this whole idea about how you could begin for people who are paralyzed to control a robotic arm to carry out fairly sophisticated activities, including the ones you mentioned. This is a big part of what the BRAIN Initiative, which involves NIH and DARPA and NSF, as well as the Department of Energy, as well as some international partners, aims to do, is to really figure out how those 86 billion neurons between your ears do what they do in these complicated circuits, which we're beginning to take apart and understand even better. Because we would like to go from where we are now, which was sort of an empirical effort to get this to work, to really understand it so well that you knew exactly where to place those electrodes to get the maximum sophistication of the move of that robotic arm.
Last topic. We've just done some good bipartisan legislation on plastics in the ocean here in the Senate. The UN has just issued, I think, a unanimous statement of concern about plastics. Plastic, as you know, doesn't biodegrade. It just breaks down into smaller and smaller and smaller and smaller points. And then microscopic creatures can consume it, and it begins its track up the food chain. Never in human history have we had to experience that kind of plastic loading into our diet. It's now found in tap water, it's found all over the place, it's obviously going to be in our food. Is this something that the National Institutes of Health should begin doing some basic research on, so that if this turns out to be a problem, it's certainly a new experience for humankind to have to digest and process that kind of microscopic plastic in the food chain, that you're alert to it?
Absolutely. The National Institute of Environmental Health Sciences, one of our 27 institutes, but the one that's located in North Carolina in Research Triangle Park, is already looking at this. I can give you a summary of where we currently stand in terms of the research that's being conducted.
I'd appreciate that. We can do that offline and through your staff.
Be happy to do that.
Thank you, Chairman.